Hi guys, it's Dr. Bailey again. So I have to talk about this because it's so important, especially for breastfeeding moms. Did you know that your baby already has a built-in breastfeeding approach? And this approach is so important to them when they're latching. So I need all my new breastfeeding moms to listen up. So when you're looking at your baby, there are a couple of things that happen, and I'm going to go through it kind of step by step. So first off, your baby is going to, in some cases, have more of a rooting reflex. And what that is that if you look at them, they're going to open their mouth like this, and they'll turn to the side. So it's almost like they're just getting ready to start breastfeeding. Now, you can hold your baby in a number of ways, whether it's a football hold or just a regular hold where they're just laying kind of in your arms. So now, when you're looking at your baby, again, your baby may have that rooting reflex where, again, their mouth is open and turned towards the breast. What they're going to start doing is they may, and this is a thing that kind of trips parents up. They may have their eyes open, they may not, but they use a lot of their senses to get to the breast. So you may find that your baby may feel along with their hands. They may try to position your breast or try to move it. And even though they're tiny, they may use the side of their face to kind of get to and position themselves to the nipple and to the areola and to the breast itself. But either way, you really have to let them do this. A lot of parents, I think, believe, their babies are coming into the world. They don't know what they're doing. So they'll try to guide them. And I'm sure you've noticed, if you try to guide your baby or help them, they get very annoyed. They either do like a cry, or they may start crying themselves or grunt or make some form of annoyed cry. This is them telling you just to let them do what they were born to do. All right. So once the baby actually opens their mouth, you want to make sure that you put in a good amount of the areola and the nipple. In a sense, it should really look like a bottle, right? So if you have your areola, the nipple, and then areola, you just want to grab a nice piece of it just so it goes into the baby's mouth. Do not force it into the baby's mouth now. This is very key. Babies have their approach. So you may notice that your baby may come back. They may open their mouth. They may have to do a swing or move their head in a certain way. Let them do it. They know it best. They know how it feels. They know what works for them. And so again, don't try to help, just hold. And your baby should be able to navigate onto the nipple. This is really key, because I know a lot of parents get frustrated and they're like, I'm trying to help them. The baby doesn't want help. The only thing that they really need you to do is just kind of cup the breast so that, again, the areola and the nipple are formed. And so then it's ready to go into their mouths, and then let them get that approach onto the nipple and then fasten on. Now, once they do, you want to make sure that they're getting the areola and the nipple. Do not get just the nipple. It is so painful. There are some of my moms who are like, look, I don't know. They just latch on, but nipple feeding is so painful, and it's also counterproductive, because the baby needs to latch on really to part of the areola. Why? Because once they latch on with their mouth, let's say this is the mouth, they're going to do a quick feed or signal. It's going to be like, joo, joo, joo. So you'll notice once they latch on, they go joo, 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 with their mouth. What that does is it signals to your brain essentially to help that milk release down. And then that's where you're going to get the letdown from the breast. Now, this is also key. Babies know that the letdown varies. We don't, sometimes we get caught up in it. We're like, what's going on but you may notice that if your baby latches, all of a sudden they move out of the way. What that means is that your letdown may be pretty quick, and really what they're doing is they're just kind of assessing and moving it out of the way. So they may just disengage from the nipple and then latch back on, or may just move out of the way for a little bit, then latch back on, because they know that the letdown will be quick. Others, it may be slow. Now, this is the thing. Once they do that with their mouth on your nipple or on the breast, what they're doing is, again, they're waiting for that letdown. If they don't feel, or if they don't start tasting the milk, they're just going to wait. So if it's with their mouth, they'll be like on the breast, and then they're waiting. Then they're going to do it again, and they're going to wait. And again, they may try it a couple more times. If milk doesn't come down, then that's where they're going to be like, and get really annoyed, or they'll start crying, okay? Because then they're like, what's going on? This should be working. And then you can kind of look at reasons why your milk may not be coming down, okay? But this is so, so key. So do not try to guide, do not try to force, do not try to hold the head. Don't try to do that. You just really want to support the baby, because your baby is born, knows really how to latch, and really all you're doing is supporting the baby to latch. Now, I'm not discounting other things. I'm not discounting if a baby, may have like a poor suck issue or like a cleft palate or anything like that. Now, I'm just saying that for the most part, your baby comes out with that innate knowledge anyway, right? Even regardless if they have some sort of issue with like a tongue tie or things like that, they still know how to latch. And so, and they still have an approach. They may need help with that latch now, and we may still need to do some things to help with that, but just respect that approach. Respect that they are confident in that approach, and that they can be very irritable if you start kind of getting in the way of that. And you'll notice that. The cries, again, are going to be something like, and you'll know. They'll get angry, they'll kind of move around, or they'll be like, but these are just annoyed cries. So just so that you can start understanding your baby a little bit more, this is really essential for breastfeeding, and it's going to make you feel better and your baby feel better. For more tips and tricks, please go to our website at www.askpeds.com. You can also check out our YouTube channel and our TikTok channel. All right, guys, take care.